So first we're going to educate you on the difference between the shoulder girdle and the shoulder joint. The shoulder girdle is between the scapula and the clavicle, and the shoulder joint is where the axioskeleton meets the appendicular, and that's with the humeral head inside the glenoid fossa. So now we're going to talk about the actions at the three main joints. The first one is the sternoclavicular joint, which it moves about 15 degrees with protraction and retraction of the scapula. The second joint is the acromioclavicular joint, which moves about 20 to 30 degrees with flexion. And then the last joint is the scapulothoracic joint, which is going to be on the other side right here. And then that moves with elevation and depression of the scapula.
Now we're going to talk about the different bony landmarks. So first, starting off with the manubrium, which is right here. You can find this bony landmark by placing your hand on either side of the clavicle and following it immediately until you come to a V, which is the superior border of the manubrium. And this is significant because it's an attachment site for the clavicle, and it also makes up the axial skeleton. Next, we have the clavicle, which has sternal and acromial ends, the sternal end being more medially and the acromial end being more laterally. And the significance of the clavicle is that it connects the arm to the trunk of the body. Next is the acromion process, which can be found by placing your hand on the clavicle and following it laterally until you feel a large bony structure sitting on top of the shoulder. And the significance of the acromion process is that it connects the clavicle to the scapula via the joint. And lastly, the coracoid process, which I'm going to turn Caitlin around posteriorly, which can be found by placing your hand on the superior portion of the scapula, and you can feel for a large, roundy, bony structure on top between the spine and the most lateral portion of the trunk. And it can also help you to find the coracoid process by placing the subject into protraction. So if you want to go into protract forward. This makes it a little bit easier to palpate. And the significance of the coracoid process is that it's an attachment site for muscles such as the pectoralis minor, the coracobrachialis, and the short head of the biceps brachii.
Now we're going to palpate the scapula. So first we're going to start by finding the lateral border of the scapula. So you're going to want to place your hand and find the scapula and then move it laterally until you find the lateral border of the scapula. You'll know you've gone too far when you can feel adipose tissue, which is a little bit more lateral. The significance of the lateral border of the scapula is that it's the site of the glenoid fossa. Next, we're going to palpate the inferior angle of the scapula. So that is the lower bony prominence of the scapula. And the significance of it is it's great palpation site for following the movement of the scapula during movements. Next is the medial border of the scapula. So you're going to place your hand and go medially until you find the medial border of the scapula. And then again, you'll know you've gone too far if you can feel more adipose tissue. And it may help if your patient protracts their shoulders while palpating. So if she protracts them, I can feel it a little bit better. And then the significance of the medial border of the scapula is it's the rhomboid major and minor attachment for retraction. And then lastly, we have the spine of the scapula. So you want to place your hand on the lateral superior aspect of the scapula and then move it medially along the bony structure that resembles the spine of the scapula.
The scapula needs to move in order to provide both stability and mobility of the glenohumeral joint, which is a multi-axial joint. So the first two movements, elevation and depression, the scapula moves superiorly through elevation and then inferiorly through depression. Protraction, retraction. With protraction, the scapula move through towards an anterior position, and then with retraction, they move back to the posterior side. Upward rotation and downward rotation, you'll see the scapula move. With upward rotation, it moves laterally, and then downward rotation, the scapula moves medially back towards the spine.
Because she has really tight, dominant, overactive, anterior located muscles, we want to strengthen the back muscles that are a little bit weaker from the overactive anterior muscles. So all posterior muscles on the back, and as Superman, she'll pull up, hug her shoulder blades behind, and then she'll activate all these muscles in here and go through a couple repetitions to strengthen the back of the body rather than the anterior portion of the body. Since she has a lot of pain in this area, a nice stretch for that is to interlace your fingers at your low spine, hug your shoulder blades behind you to open up the anterior aspect of your body, and then slowly tilt your head away from the area of pain. So for this, we would get a really nice stretch in all these muscles in here. A soft tissue massage that you can do is to place a tennis ball into the area of pain, come up to a hardened wall or door, and then slowly move medially and laterally, side to side, to release some pain and tension.